Welcome to Medigap TV. Real answers about Medicare in plain English.
If you are turning 65 or getting ready to retire, Medicare does not have to be confusing. In this video, I am breaking down parts A, B, C, and D in plain English so you have a clear foundation before you make any decisions that could affect you for the rest of your life. Here's the truth. Most people get their first Medicare information from friends and family. And while they mean well, that advice is often wrong. One missed enrollment deadline can create a permanent penalty, and that penalty is added to your premium for the rest of your life. And confusing Medicare supplement plans with Medicare Advantage is one of the most expensive mistakes I see. These are two completely different products. Choosing the wrong one can cost you thousands of dollars every single year. Let's start with Part A, your hospital insurance. And here is the good news. For most people, Part A is completely free. If you or your spouse worked and paid Medicare taxes for at least 10 years, you owe nothing. Part A covers inpatient hospital stays, skilled nursing facility care, hospice care, and home health care when it is medically necessary. But here is something critical. Being placed under observation status at a hospital is not the same as being admitted as an inpatient. That one distinction can significantly affect what Medicare covers and what you owe out of pocket. Part B is your medical insurance. And unlike Part A, everyone pays a monthly premium. In 2026, the standard premium is $202.90 per month. If your income is higher, you may pay more. There is also an annual deductible of $283. After that deductible, Medicare pays 80%, and you are responsible for the remaining 20%. Part B covers doctor visits, outpatient procedures, preventive services, durable medical equipment, and outpatient mental health care. Now, here is what you must understand. That 20% coinsurance has absolutely zero out-of-pocket maximum. None at all. And that gap is one of the most important things you can take away from this entire video. Let me show you the key numbers for parts A and B side by side. For Part A, the inpatient deductible is $1,736 per benefit period. Days 1 through 60 of a hospital stay have zero daily copay. From days 61 through 90, you pay $419 per day. For skilled nursing care, days 1 through 20 are covered in full. Days 21 through 100 cost $209.50 per day. Now on the Part B side, the monthly premium is $202.90. The annual deductible is $283, and after that deductible, you pay 20% of all covered services with absolutely zero out-of-pocket maximum. Let that sink in for a moment. Zero ceiling. That is exactly why most people need additional coverage on top of original Medicare. Part C is called Medicare Advantage, and the first thing to understand, it is not a government plan. It is private insurance approved by Medicare. Private insurance companies take parts A and B, bundle them together, and usually add prescription drug coverage along with extra benefits like dental, vision, and hearing. When you enroll in a Part C plan, you leave original Medicare entirely and use the private plan instead. Many Part C plans have low or even zero monthly premiums, and that sounds very appealing. But here is the trade-off. You pay copays and coinsurance each time you use your care. If you stay healthy, that can work out fine. But if you get seriously ill, those costs can add up very, very quickly. Before you enroll in any Part C plan, there are 4 questions you must be able to answer. Number 1, are your doctors in the network? Part C plans use HMO or PPO networks. If your doctor is not listed, you either cannot see them at all or you pay significantly higher out-of-network rates. Number 2, are your hospitals in the network? A hospital that accepts Medicare does not automatically accept your specific Part C plan. Number 3, are your prescriptions covered? Every plan has its own formulary, and your medications may be excluded entirely. And number 4, does this plan cover your zip code? Plans change every single year and can exit your county without warning. If you cannot confirm all 4 of these before you enroll, do not enroll until you can. Now, here is something that confuses a lot of people, and I want to make it crystal clear. If you have a Medicare Supplement plan, you are not on Part C. You absolutely cannot have both. These are 2 completely separate paths, and you must choose one. Path 1 is original Medicare plus a Medicare Supplement, sometimes called Medigap. You keep Parts A and B, and a private Medigap policy covers most or all of the costs that original Medicare does not pay. You can see any doctor or hospital in the entire country that accepts Medicare. 0 network restrictions, none at all. You will still need a separate Part D plan for prescriptions. Path 2 is Part C Medicare Advantage, which replaces original Medicare entirely with a private plan that usually bundles everything together. We do a full comparison of these 2 paths in our next video. You will not want to miss it. Part D covers your prescription drugs. You can get it as a standalone plan if you are on original Medicare, or it is often bundled inside a Part C plan. And here is a big update for 2026. The out-of-pocket cap for Part D is now $2,100 per year. Once you reach that amount, your covered drugs cost you nothing for the rest of the year. Every Part D plan has its own formulary with drugs organized into tiers. Generics are Tier 1 and the lowest cost. Specialty drugs can be Tier 5 and significantly more expensive. If you delay enrolling in Part D without other creditable drug coverage, you will face a permanent penalty added to your premium for life. And if your income is limited, ask about Extra Help. It is a federal program that can dramatically reduce your Part D costs. Original Medicare is powerful, but it does not cover everything. And these gaps matter. There is absolutely 0 out-of-pocket maximum under Parts A and B. A serious illness could cost you tens of thousands of dollars with 0 ceiling. Outpatient prescription drugs are not covered under Parts A or B at all. That is exactly why Part D exists. Routine dental, vision, and hearing are excluded entirely. Medicare does not pay for long-term custodial care or assisted living. Coverage outside the United States is extremely limited, and cosmetic procedures are not covered. Understanding these gaps is exactly why the choice between a Medicare Supplement and Medicare Advantage is the most important Medicare decision you will make. Let me bring it all together for you. Parts A and B are called Original Medicare. Part A is your hospital coverage. Part B is your medical coverage. They are your foundation. Part C, Medicare Advantage, is a private plan that replaces Parts A and B entirely. Part D covers your prescription drugs and can be standalone or bundled inside a Part C plan. Here is the key takeaway. You are not collecting all 4 parts. You are choosing a path. Either original Medicare with a supplement and a standalone Part D plan, or a Part C Medicare Advantage plan that bundles everything together. That choice is what we help you make. If you are finding this helpful, hit the like button and subscribe so you never miss a video. We release new Medicare education content every single week right here on Medigap TV. Now that you have the foundation, the next step is figuring out which path is right for your specific situation. Take the free Medicare Clarity Quiz. It is 7 questions, takes about 2 minutes, and gives you personalized results instantly. No phone number required to see your results. The link is in the description below. Go to mymedicaresupplementplan.org/Medicare Clarity. I am Lauren Marmis. I have been a licensed Medicare specialist for 16 years, serving clients across 46 states. And I am here to make sure you get this right. If this video helped you, please hit the like button and subscribe. It helps more people find this information when they need it most.